Okay, so for the purpose of this video, I decided to use two softballs to represent the testes, and for the testicular artery, I used red wire, and for the pampiniform venous plexus, I decided to use blue tape that I curled up and wrapped around the red wire. So if this were enclosed, it would represent the spermatic cord. This bag represents the scrotum. So if I place the testes attached to the spermatic cord into this bag, I now have an example of the testes within the scrotum. Okay. So my topic for this video project will focus on male reproductive anatomy, and more specifically, complications of the male reproductive system. So as a male, most of our reproductive organs are on the outside of our body. They protrude. So this means that we must be on guard and try to protect ourselves from the dangers of the world. Now, it's kind of hard to tell from some of the diagrams in our anatomy textbook, but our testicles, our testes, move freely from the scrotum. You can kind of think of the scrotum as a bag, and the testicles as, two softballs. Here's an example. All right, so this bag represents the scrotum, and these two softballs inside represent the testes. And as you can see, the testes can move around freely within the scrotum, because the scrotum essentially only acts as a bag. So they can shift and move around, go up, go down. They basically have freedom to move anywhere they want in the scrotum. You might be thinking, how does something so delicate have the freedom to just move around like this? And I definitely agree. Like, as a man, we have to take precautions so we don't, hurt ourselves just in daily life. So we can take these precautions by wearing tight underwear, and naturally the friction between the skin of our legs and our scrotum keep everything from shifting around too much. So even still, unexpected things can happen. And in this case, I'm referring to testicular torsion, which is exactly as it sounds. The testicle twists within the scrotum. Now, keep in mind that the whole scrotum does not twist, only the testes inside. Now, our testes are very intricate and contain many ductules and tubules. But for the purpose of this video project, I will mainly focus on the cord that supplies the testes, which is known as the spermatic cord. Now, this cord contains a bunch of tissues and fibers that run from the testes up and through the abdominal region. When testicular torsion occurs in a male, this cord becomes twisted, thereby cutting off blood supply. When the blood supply is cut off, the result is severe pain and swelling. When this happens, emergency surgery is necessary and requires a simple untwisting of the testicle. Here is an example. The testicles can rotate too far. And once that happens, they twist. And you can see in this example that the spermatic cord is also twisting. And when this happens, the blood supply to the testicles gets cut off and restricted. So what would happen is a surgeon would actually have to go in and unwind it. And of course, stitch it back together. The scrotum.